Did you know that overdose is the #1 injury-related death cause? In 2015 alone, we had over 50,000 die from a preventable disease of addiction. The CDC called this an epidemic. Well, let's look at the 5 important things we need to know about the brain and addiction. The #1 thing we need to know about the brain and our addiction is dopamine, the neurotransmitter dopamine. As you can see here, on our worst day, our brain produces 40 nanograms of dopamine per deciliter. And on our best day, our brain produces 100 nanograms of dopamine per deciliter. Our brain is not built to handle more than our best day of 100 milligrams, and it's not built to hold less than our worst day of 40 nanograms. Therefore, when you add in a drug into your system, it pushes up the dopamine that is produced to over 10 times the normal dopamine output of our best day, which is 1,100 nanograms per milliliter. So because of this, our normal everyday activities that are normally pleasurable become unpleasurable. That is why drugs are so addictive. It is also important to note that dopamine drives our survival mechanisms, which is a problem when it's off balance, meaning that we have less than 40 or more than 100 nanograms. And eventually this person has to take their drug of choice to get the amount of dopamine they need to survive, which on a normal day is 50 nanograms per deciliter. Second important thing we need to know about addiction is craving. Now, craving drives primal behavior, and to look at craving, there was a study that was done with functional MRIs. When patients were dehydrated for 3 days, their anterior cingulate gyrus, which is the part responsible for cravings, when they were thinking about water, it lit up to about a baseball size. When this was done with starvation, meaning that the patients didn't have food for up to 5 days, that same anterior cingulate gyrus lit up to, when they were thinking about food, lit up to a basketball size. Now, when this was done with patients who did not have their drug of choice for up to 2 years, that same anterior cingulate gyrus lit up to the size of a baseball field. So, dehydration to drug of choice, pretty big drastic difference. And this baseball field size only happened for up to 2 years. After that, patients did not really have that craving feeling and beyond. However, it is important to know, and we will come back to it later, about relapses. The third thing that's important to note about the brain and addiction is motivation. In this case, motivation and dopamine are synonymous. If a patient has a lesser version of an opioid use disorder, a medication such as naltrexone, which blocks the effects of the opioid use, or the opioid of choice, would be effective because that patient already has an intrinsic motivation to curb their habits and their addiction, even though it is hard. Now, for some drugs, the effect that the drug has on dopamine is, for some of them, it is directly about controlling their dopamine intake and their dopamine production, and for others, it is indirectly about controlling their dopamine and their dopamine production. And this is, if you have, in general, dopamine, you are able to stay motivated to not only onboard therapy, but also to stay retained in treatment if your dopamine levels are proper. So for some drugs like opioids and meth and cocaine, it would be to say to directly control the dopamine levels, while some drugs like marijuana is to indirectly control your dopamine levels, and you can do that through medicines such as naltrexone. So the fourth thing to note about, like I said earlier in the video, of the brain and addiction is relapse. So it is stated that if you reduce craving, you are more likely to reduce the chance of relapse in a patient. This is because during the day, the more decisions you make, the less likely you are to make a good decision later in the day. This was studied with parole people and prisoners, but there is a real thing called choice fatigue. So, relapse happens because during the day, the person wakes up and they think, I don't want to use, please don't let me use. And then during the day, they have the choice to either A, use their drug of choice, or B, to not use A, to use their drug of choice, and B, to not use their drug of choice. And during the day, the more they have to think about this of not using or using, the more they make the decision to not use, the less likely during the day, as the day goes on, that they will choose not to use their drug of choice. And if you haven't controlled your craving, you can't reduce relapse, because if you have not controlled your craving in any other way, with therapy, with medication, then the more likely later on in the day that you will be to choose to use your drug of choice, because your urge, your craving to use it is so strong. And this is why using therapies and other medications to reduce craving is important, because of the likelihood of relapse due to choice fatigue. So, the fifth and final thing that it is important to know about the brain and addiction is stigma and society in general. So, society has effectively now created stigma to being discrimination. Doctors are now not doing ethical things to treat patients with addiction because of the stigma that comes along with addiction. So it is also important to note that we should use a science approach when looking at addiction and how to treat addiction instead of a beliefs approach. And along with stigma, we have to stop criminalizing people with addiction, because if you throw somebody in prison with signs of addiction and you don't get them any treatment, that is not really helpful to them, nor is it helpful to society. And we need to stop criminalizing them, because we have a treatment for this disease for these patients. And, you know, the inevitable happens. We have our brain becomes diseased, so people end up with addiction anyway. But we should be looking at preventing addiction and this disease through good and accurate information given to kids and people at a young age. So that's where prevention should start, instead of giving them to the older kids. Let it just be known that addiction is a predictable chronic brain disease and not a moral judgment lapse. And we have treatments for addiction that are 60 to 75% effective. However, little to nobody has access to these treatments, and that is why there is stigma in society. And if we can get rid of the stigma to get access to the treatments, then we can come out preventing addiction rather than treating addiction. Thank you for watching, and I hope you enjoy.